Hello and welcome to Kitchen Magic's 2020 Open Enrollment presentation. My name is Vicki Dulay. I'm a Senior Vice President at BSI Corporate Benefits, and we are the benefit consultant that works with Kitchen Magic, and I'll be reviewing your benefits with you today. So in reviewing the agenda with you, we'll be spending time talking about what's staying the same with your benefits. We'll spend some time talking about your medical and prescription benefits, and we'll also review the new contributions for July 1st. I will talk about the fundamentals of the health savings account or HSA plan. Some of you may be enrolled in it today, so it will be a refresher for you. For others, it's just meant to help you learn the benefits of enrolling in the HSA program. We'll talk about your telemedicine benefit, Healthiest You, and also we'll spend a few minutes talking about ways that you can control costs and make some, good decisions around the money you spend on your health care. We'll talk about your dental and vision programs, and then also member advocate tools that are made available to you, the BSI Concierge or Customer Service Program, as well as Connect Care 3. And then we'll finish out the presentation with the open enrollment process and what that will look like for you this year. And to get started, what's staying the same? Your medical program is staying the same. The three options that were offered to you last year are being offered to you again through Capital Blue Cross, same network, same covered services, and also same pharmacies, doctors, hospitals, and one ID card you'll have for not only your medical and prescription, but for your vision, and your dental will be moving to Capital Blue Cross, so that will also be on the same ID card. And you will get a new ID card this year because of that, because it will reflect the dental coverage being new. For those of you that use the health savings account, we'll continue to utilize Optum Bank. Vision is remaining with Capital Blue Cross, same plan design, same contributions as well. From an eligibility requirement standpoint, you do have spousal coordination. So what that means is if your spouse is employed somewhere else and they are offered health insurance coverage, they need to take that through their employer. They're not eligible to enroll under your plan as your spouse. If you do need to have your spouse on the plan, you'll be asked to have your spouse's employer complete a form to affirm that they're not offered coverage through their employer prior to enrolling. So you will need to fill out that form. This spousal eligibility applies to medical, dental, and vision, and it is very, very common from a standpoint of each employer. The expectation is they're covering their employees, and if spouses have coverage through their employer, they're to take it that way. So that's a very common provision at the majority of employers in the Lehigh Valley. And the spousal eligibility applies to medical, dental, and vision as well. Dependent children. Regarding dependent children, if your spouse has coverage through their employer, you have coverage through Kitchen Magic, there's no hard and fast rule on where the children are to be enrolled. They can enroll in either plan, so that's a decision for you and your family. But dependent children can remain on the Kitchen Magic plan until the age of 26. So now we'll spend a few minutes reviewing your medical benefits. This slide shows the three benefit programs that are offered to you, the benefit plans. The first program is the PPO 3000 plan. The way that the PPO 3000 plan works is you have a $3,000 individual deductible. That is two per family. When you meet that deductible, you are then covered at 100%. The plan picks up 100% of that coverage. But with the PPO plan, the regular PPO plan, you don't pay the full cost of office visits, rather you pay a copay. So if you're going to your family doctor or a pediatrician, it's a $30 copay. If you go to see a specialist, say a cardiologist, it's a $50 copay. If you go to the emergency room, the copay is $200. Urgent care is $75. For outpatient surgery, you have a copay. So if it's at a freestanding facility for an outpatient surgery, it's a $250 copay. But if you have outpatient surgery done at a hospital, it's a $500 copay. So you do pay more in a copay if you're having it done at a hospital. If it's a freestanding facility, it's $250. So in general, that deductible that I talked about, the $3,000, that applies when you're having an inpatient at a hospital. So if you're having surgery where you're staying over at a hospital, you'd need to meet that deductible first, and then the plan picks up at 100%. Preventive care is covered at 100% through the PPO 3000 plan. For prescription drugs, you do have a separate $250 deductible. Once you meet that, then you pay the applicable copay. So for retail, for a brand name drug that's on the formulary, after you meet your deductible, you would pay $45. If you're getting that through mail order for a 90-day supply, it would be $90. So that's how the PPO 3000 works. It is the richest plan of the three choices that you have, and that's why your contributions are higher for this plan than for the other two. But then we move on to the qualified high deductible plans. The first option, the deductible is $2,750, and for a family, that's $5,500. With the qualified high deductible plan, you don't pay copays with office visits. It doesn't work like that PPO. You are responsible for the cost of office visits, the cost of prescriptions, the cost of outpatient surgery. If you go to the emergency room or urgent care, you're paying those costs up front until, as a single, you've paid $2,750. Then the plan picks up at 100%. The exception to that is once you meet that deductible, you do need to then continue to pay the retail and mail copays for prescriptions. When your deductible and those copays add up to $6,650, then this plan would pick up at 100%. It's not likely that you'll meet that out-of-pocket max just on the prescription copays. So in general with this plan, once you meet your deductible, on the medical side, everything will be paid 100%, but you'll continue to pay your retail and mail order copays. One thing to note with the qualified high deductible plans, if you are enrolled with your spouse or with a family, that family deductible of $5,500, even if only one person is using the benefits, they need to meet the family deductible. So when you're enrolled as a family, your deductible automatically is $5,500. So it's just important that you're aware of that with the qualified high deductible plans so that you know that you need to meet that higher deductible on the front end. Now, the third plan, the PPO 6650, that's also a qualified high deductible plan. And there your deductible is much higher. For a single, it's $6,650. For a family, it's $13,300. So this one acts as almost like a catastrophic plan. It's giving you coverage, but you are going to be paying a lot out of your pocket on the front end until you meet either that single if you're enrolled as a single deductible or the family deductible if you're enrolled with you and anyone else on the family. So it is a high deductible on the front end, but your contributions will be the lowest on this plan. So that's something that you need to look at as you make your decisions is how do you use your benefits. With this plan as well, once you do meet your deductible, prescription drug is covered at 100%. You're not having any more of that cost sharing because that deductible is so high. So you've had a lot of out of pocket at that point. You basically are reaching that maximum out of pocket. And then the prescription would be covered at 100%. We'll talk a little bit more about the HSA in a few slides, but for both the qualified high deductible plans, the 2750 deductible and the 6650 deductible, you are able to save money into a health savings account to help pay for services. So keep that in mind as you're making your choice. You do have that added benefit to put pre-tax dollars into a bank account to help pay those deductible amounts. With the PPO 3000, that's not a qualified high deductible plan, so you are not able to have an HSA tied to it or make pre-tax contributions if you enroll in that plan, only if you enroll in the qualified high deductible plans. Now, from a contribution standpoint, the next slide, we have very good news. And your contributions are going down basically 30% from last year. And that's really a testament to the Kitchen Magic team and all of you for the changes that were made last year and some, really positive decisions around wellness programs that were implemented. The smoking cessation plan is one example that was implemented last year. So really commend all of you on making some really good choices. The results show this year in your healthcare renewal and the reduction that Kitchen Magic was able to give to you guys. So to have that 30% reduction is pretty significant. So for the PPO 3000 plan, for example, I said was the richest plan that biweekly or every 24 pays $135.64. On the qualified high deductible plan with the 2750 deductible, that contribution is $129.81. So, and then on the 6650 plan, it goes all the way down to $52.51. So like I said, with that plan, that's more of a catastrophic plan. So what's coming out of your pay is a lot less because you will be paying more towards your health care in that plan design. And so we were very excited to give you the good news about the reduction to your contributions. And to talk a little bit more about the health savings account, this slide helps to show really how, and we use the example of the 2750 plan, it really helps to show how it works. So the bottom box in blue, the member responsibility box, that is representing that you're responsible for that deductible, whether it's the single or the family deductible. Once you meet that, then in the green box, the plan is picking up 100% of the medical coverage, and then you're still paying your RX copays after the deductible. The dark blue bar on the side is showing that your preventive care is covered at 100%. So if you are having a mammogram or a colonoscopy on a preventive basis, or you're taking your children for immunizations at the pediatrician, those services will be covered at 100%. You will not need to meet your deductible for that. So that's something to keep in mind. And if you're in the higher deductible HSA plan design with that 650 deductible, please know that you can get your preventive care covered at 100%. Now, what you are able to do on a pre-tax basis is contribute to a health savings account, and that money is put into a bank account through Optum. You end up getting a debit card that looks like a credit card that you can then use to pay your providers. When a claim goes through Capital Blue Cross's system, the provider is made aware that you have a higher deductible plan, and let's use an example. In July, you go to have an MRI done and you haven't met your deductible yet. You won't have to pay up front, but you will get a bill from that provider saying, hey, this MRI costs $200. You owe this because of your deductible. So you can use your HSA bank account to pay for that. And the way you fund the bank account is through pre-tax deductions. So it's important that if you have that HSA plan and you'd like to have that savings ability, that you do make sure that you're contributing money in each of your 24 pays. The maximum in 2020 that you can contribute is $3,550. So it did go up $50 from last year. And for a family, it went up $100. So it's up to $7,100. So that lets you know how much the government allows you to have taken out of your pay on a pre-tax basis. But the great thing about that then is it's in that bank account and it rolls over from year to year. So if you end up not using your benefits a lot, you've saved that money on a pre-tax basis and you can use it to pay for qualified medical expenses in future years. If you're 55 or older, you can actually contribute an additional $1,000. So there's a lot of real positives about the HSA plan. You have control over that money. You can use it to pay for any qualified medical expenses as defined by the IRS. So as long as it's qualified medical expenses, you can use the money to pay for it. So if it's, in your current plan, something that was subject to the deductible, you can definitely use it for that. If you aren't enrolled in vision and you get a pair of glasses, you can use it to pay for glasses. You can use it to pay for LASIK surgery. You can use it to pay for orthodontics that won't, the 50% that's not covered under your dental plan, for example. So there's a lot of control and flexibility on how you use your funds. You keep the money in that HSA savings account and it rolls over from year to year. So you have that portability. And even if you leave Kitchen Magic, you can take that HSA account with you and you don't have to worry about using it in the same year. It rolls over from year to year. And I've mentioned the, pre-tax savings multiple times, but that's a really good way to have money set aside on a pre-tax basis so that the government's taxing your money after those contributions. So those contributions aren't subject to federal taxes. So it's just important that you keep that in mind as you make your decisions. And we talked about how you can use it. You do have a lot of flexibility on how you can use those dollars as long as they're qualified medical expenses. So you can't use the money to buy a TV or you'll pay a penalty, but you can use it for any qualified medical expenses as defined by the IRS. Telemedicine, the Healthiest You benefit was rolled out last year, and I know many of you have used it. If you haven't used it, we encourage you to enroll to use it because this is a benefit that Kitchen Magic offers to you that you don't pay anything for. So if you have a situation where you use the telemedicine benefit, let's say your child has pink eye and you use the Healthiest you pay nothing for that. There's no office visit copay. You're not paying anything towards that office visit. The only thing that you pay for when you use the Healthiest You is any prescriptions that are a result of the visit. So in the example of pink eye, if drops are prescribed, you would pay for those drops per your medical plan. But outside of that, you're not paying any copay, any deductible on the televisit. And it really, can help you to avoid using urgent care or the ER. You want to remember that you have this benefit. The Healthiest You and the doctors that are involved end up sending the prescription directly to your pharmacy. They use U.S. board certified doctors throughout the country. It is available 24/7 to you, either on the internet, on the mobile app, on your phone, and you can it really is a good way to avoid having to go to the doctor. And it's available to you as an employee and all your members in your household, even if they're not on your Kitchen Magic benefits. So that's another nice benefit of the plan, so that you can use it even if your spouse isn't enrolled on your plan and they have an issue, you can use the Healthiest You app. And this next example really digs into the value of the Healthiest You benefit. So I talked about pink eye. Under Healthiest You, there's no cost other than the prescription, no travel time. Your typical wait time is under 10 minutes. So when you use the app and you indicate that you need a call from a provider, you go through what the issue is, they get back to you very quickly. The prescription's called in and, under an hour, you have your prescription in hand. With an emergency room situation, you could pay upwards of $1,000. You have the travel time to the ER, you have the wait time, and we're probably being generous with 30 to 60 minutes. You could sit there much longer. And the same holds true with urgent care. The cost isn't quite as high with urgent care, but with Healthiest You, there's no charge. And, it can be used for, I used pink eye as an example, if you have an upper respiratory infection, if you have poison and you have a rash and you want the doctor to take a look and, call in a prescription, that's what you can use this for. And in our current environment with COVID-19, you see more and more providers, local providers, using virtual visits. Well, with Healthiest You, you've already been using that since last year. Now it's even less of a reason to have to go into the doctor when you can use Healthiest You from the comfort of your own home. And I'll just take a second to talk about the local providers doing virtual visits. Please don't confuse those with Healthiest You. I'll use an example. Let's say you have a visit scheduled with your cardiologist, and because of COVID, you want to do it virtually, and that's offered through the healthcare provider. That would run under your medical benefits. So you wouldn't have to go into the doctor's office, but it would still count as an office visit that would run through your normal benefits. So it's a great benefit that providers are starting to do virtual visits, but please know that runs under your medical benefits. The Healthiest You that I've talked to you about, that is separate from your medical benefits, and it's really meant to save you money on that office visit end of things or emergency room or urgent care. So we encourage you, if you haven't registered, to download the app and register. It is really very easy to use. If you've already registered, there's no need to re-register. I'll spend just a couple of minutes going over some cost savings tips for you. This next one is a big one. It's Capital Blue Cross's Search and Save tool. And please know that these tools are available for you to become better educated healthcare consumers. So the example on the screen is, let's say you go to your doctor and they order an MRI of your lower limb, of your leg. And a lot of times the easiest thing to do, especially, if you're in a hospital-based doctor's office, is to walk across the hall and get the MRI done at the hospital. The issue with that is that the costs are a lot higher when you do it that way, as opposed to going to a freestanding facility. So by using Capital Search and Save tool, you can get an idea of what costs are and what providers are available to you, so that you have a better idea of what the hospital costs versus someone who's freestanding. So this example is Pinnacle Health, and this isn't local, this is in the Harrisburg area, but that lower limb MRI would cost close to $1,400 in the hospital setting. To go to a freestanding facility, $350. So when you think about it, with your deductible costs on the PPO 3000, that would go toward your deductible. With the HSAs, you would be paying that up front. It's a lot better to pay $350 versus $1,400. So you can save upwards of $1,000. It's worth taking your time. If it's not something urgent that has to be done right then, take a script with you and then make a decision on where you'd like to get that MRI done in this example. And it may end up being at the hospital. If that's your personal decision, that's fine. But just know there's information out there for you to be able to shop the services similar to how you shop for a TV or on Amazon, that you see prices and you make decisions based on it. Today, there's a lot more transparency and information available on the cost of services so that you can then make the best choice for you. Mail order versus retail for prescription drugs. Just mentioning that if you are on maintenance medication and you go to the pharmacy every month, we really urge you to consider using mail order. It's on average 7% cheaper to use mail order, but even more importantly, it's the convenience of not having to go to the pharmacy every month, especially now. The medication gets mailed to your home, and it helps you to make sure that you continue to take your maintenance medication, because if you're late on filling the prescription at the pharmacy, by getting it through mail order and having that longer day supply, the 90-day supply, you're more likely to take your medicine on an ongoing basis. So we encourage you to consider mail order if you haven't in the past. And then generic versus brand medication. I'm probably not telling you anything that you don't already know, but generic medication is typically 80 to 85% cheaper than brand name medication. And it is regulated by the FDA so that the active ingredients are the same in the generic version of the brand name drug, so that other than inactive ingredients, everything is the same about the prescription, and you can save a significant amount of money by getting generic versus brand. With the copays, retail copays versus brand copays, there's savings there. So in that regard, you do have savings. But when we think about the fact that you have a deductible on the PPO 3000 plan or with your HSA options, you're paying the full cost of the medication up front until you've met your deductible. You can be looking at a difference of hundreds of dollars for a brand name drug versus generic. So we encourage you to consider taking generic if one is available, because it is a lot less expensive and it does have the same quality as the brand name drug. Urgent care versus emergency room. I spent some time talking about the Healthiest You, the telemedicine, but you may find yourself in a situation where you're not comfortable using telemedicine and you need to get care and it is urgent. Just to explain the difference between urgent care versus emergency room care, you can go to urgent care for minor emergencies. So we have listed here sprains, broken bones, flu and colds, eye, ear, other infections, sore throat, minor stitches. Some of these you should use telemedicine for because that's going to be the least expensive option. But if you go to urgent care, in the PPO example, your copay is $75. For emergency room, it's $200. So only use emergency if it is life and limb threatening and it's that urgent. So examples here are heart attack, signs of stroke, poisoning, like uncontrolled bleeding. In situations like that, absolutely go to the emergency room. It is more expensive, but it's there for a reason. We don't want you using the emergency room for things that you could use urgent care or telemedicine for. In this example, you save money on your copay. In the HSA examples, when you're paying the full cost, it can be a difference of thousands of dollars, urgent care versus emergency room care. So just know that you have options there. And today, with so many urgent care centers around, that's another way to save money. And if you go to urgent care and they feel you need to go to the emergency room, they'll send you there and have you go to the emergency room right away. So just keep that in mind as you're making those decisions. Now, your dental benefits, effective July 1st, your dental benefits are moving from Guardian to Capital Blue Cross's dental. It's the dental PPO Plus. With their program, it matches very closely to your current program. So you do have a calendar year deductible of $50 for a single. That's 3 per family. The deductible only applies to your major services and then also for basic fillings and extractions. So it does not apply to your diagnostic and preventive services. So if you're only going to the dentist 2 times per year, you're not going to have to pay your deductible. If you do have to get a filling, your deductible would apply to that, or you have to have crown done, your deductible would apply to that. But for your basic diagnostic and preventive visits, your deductible does not apply, and you have 100% coverage. For your fillings and extractions, the plan pays at 80%, you pay at 20%. And for your major work, like your crowns, inlays, onlays, dentures, it's 50% coverage. You do have orthodontics through this plan to cover dependents up to age 19. That is also 50% coverage, and your deductible does not apply. So under the orthodontics, your deductible doesn't apply. Now I went ahead one. There we go. I did want to go over your lifetime maximum with you. With this plan on orthodontics, your lifetime maximum is $1,000. Under your current plan, it was slightly higher at $1,500, but it is changing to $1,000 with this plan. And the annual maximum overall on this plan is $1,500 a year per person. The plan will pay out on your behalf. If you're using your benefits just for your 6-month cleanings, you won't meet that annual maximum. You're typically meeting that when you're using the major services, it's at that 50% level. So once the plan pays out at 50%, up to that $1,500, then the plan doesn't pay anymore. You'd be responsible for the rest of the cost. And one other thing to note is that if you go to a non-network provider, that provider can balance bill, the difference between what the plan allows and what they charge. If you do happen to have money in your HSA account, if you're enrolled in the HSA, you can use it to pay for the amounts not covered through the dental plan. Now, on the next slide, will show you, and this is on the 24 pays, what your dental contributions are. And I also wanted to point out that with your current plan, there would have been a significant increase in your dental contributions, and that's why we made the switch to the Capital Blue Cross dental program. So while these are increases from last year, they would have been higher if we stayed with the current plan. So for an employee, it is $16.09 taken out of every pay for 24 pays. And then for anything other than employee, the contribution is $46.69. If you don't enroll in medical, Kitchen Magic does cover your dental program for you in full. You do need to make sure that you actively enroll in it though, if you're not enrolled in medical. It doesn't happen automatically. You do have to make this choice through the open enrollment process. For vision, I mentioned earlier, the vision staying the same benefit that you have today through Capital Blue Cross. It's a really good vision plan. You can have an eye exam once a year, once every 12 months. It's a $10 copay. You can get eye glasses or contact lenses once a year. So those lenses in your eyeglasses are covered once a year, or contact lenses are covered once every 12 months. Basically, the lenses are covered in full after the $10 copay, and eyeglasses. For contact lenses, you basically get a $115 allowance. The exception on the once every 12 months is frames for eyeglasses. They're covered once every 24 months at an allowance of $120, and then you get a discount off of the retail balance. Your vision contributions aren't changing from current, so they're staying exactly the same. Additional member advocate benefits, real quickly wanted to talk to you about the BSI Concierge program. BSI Corporate Benefits is located in Bethlehem. We're currently on work from home due to COVID, but our customer service department is still working. They're just handling calls from home. And what I want you to know about our concierge program is that we have a customer service team that is there to advocate on your behalf. So if you're enrolled in the medical benefits and your family members are enrolled, you have access to BSI's concierge program, and they'll address all benefit related issues. Rather than calling the 1-800 number on the back of your Capital Blue Cross card, we encourage you to call BSI's customer service department, because they'll advocate on your behalf. If you get an explanation of benefits that doesn't make sense, or you get a bill from your provider and something seems off, please call them. They will call Capital Blue Cross on your behalf. They will call your provider on your behalf. If you're having an issue obtaining any necessary prior authorizations for treatment, they can step in and help. They have customer service background for many years, and they really take pride in helping to resolve issues for you and advocate for you. And they're normally resolving issues within 1 to 2 days. And if it's a more complex issue, they will get back to you and keep you updated along the way. When you call into a bigger customer service department, sometimes you can get different information depending on who you talk to. So we want you to know that this is a benefit available to you, and we encourage you to please use it. And on this page, you're seeing the primary contacts from our customer service team. Beth Shoemaker is the manager of our customer service department, and Ann Runzo is specifically dedicated to Kitchen Magic. So we encourage you to call the 1-484-821-1300 BSI number. You'll be prompted on how to get to customer service. There will also be a collateral for you that has these phone numbers on, but we encourage you to call them so that they can help advocate for you. Connect Care 3 is offered through a company in Lancaster, Pennsylvania, and Connect Care 3, the way that Connect Care 3 advocates for you is they have nurses online on the phone to be able to help you navigate through, complex medical issues. They will help you with making decisions around your treatment. They will help you find providers. And if you've ever been faced with a significant medical diagnosis, it can be overwhelming. How Connect Care 3 works is, and this percentage is true, it's close to 70% of people don't understand their diagnosis or treatment plan. And so what Connect Care 3, the nurses on the Connect Care 3 team can help you with is they'll research your insurance coverage and your condition to help find options for you. They'll help to make sure you understand your coverage and your treatment plan and really help you make the best decisions you can about your treatment, your providers, and what facilities to go to. And cancer is a big one, a big condition that people call Connect Care 3, cardiology issues, neurology issues, behavioral health. So please know that this is available to you, and this is that nurse navigation, like a nurse advocate for you. The BSI Concierge is customer service to help navigate issues that you're having with your benefits. Connect Care 3 is more around your treatment and medical conditions that you have to help you navigate the healthcare system. So it is an additional member advocacy benefit that you have. So the open enrollment process, one additional update. For those of you that are enrolled in voluntary life or disability, Mutual of Omaha will be the new carrier effective July 1st. So for those of you that are enrolled today, Mutual of Omaha will take over as is with your current coverage levels. We will be doing at a later date a more specific meeting around voluntary life, because you will have the option to either enroll in voluntary life if you have it in the past or modify your current enrollment. There'll be a guaranteed issue where you won't have to give evidence of insurability. So it's a really good time to reevaluate your coverages and decide if you need more or if you need to enroll for the first time. So we will be we'll be having that meeting sometime in the next few months. And for those of you who were newer hires during the current COVID pandemic, you will have the opportunity to enroll in the short-term disability and long-term disability, the voluntary. That's only offered to you during when you're a new hire, but because of the transition and working from home, Kitchen Magic will be making an exception for those newer hires during these recent months that you have the ability to enroll in your short-term and long-term disability. And then the enrollment process, we will be having the enrollment through the bSwift enrollment platform. So all employees, whether you're looking to make a change or keep everything the same, or if you wish to waive coverage, you'll need to go through the bSwift platform. That enrollment right now tentatively will open up on Wednesday, June 24th through Monday, June 29th. It may open a little bit sooner. There'll be more communication coming from the Kitchen Magic team on the time frame as well as how you can get into the system. So be on the lookout for more of that information to come in the next few days. And this last slide is showing you your account management team at BSI. I'm Vicki Dulé. So for those of you who don't know me, that's what I look like, that I've been talking to you for the past close to 40 minutes. Liz Ramali and Sherilyn Pakiunas is also part of your service team to help. So you can feel free to call any of us with any questions that you have, and we look forward to continuing to serve you at Kitchen Magic. Thank you so much for your time. I appreciate it.